This is Dr. Michael Brisman, neurosurgeon from Long Island, and just wanted to show you about some interesting cases. This is this was not my patient, but this is illustrative of one of the types of giant pituitary tumors that we can see. So some pituitary tumors are graded as micro. They're usually almost always benign. They're called adenomas, and they're usually called microadenoma or macroadenoma, depending on whether they're bigger than a centimeter. So macroadenoma are bigger than a centimeter, micro is smaller than a centimeter. Sometimes, in rare cases, these tumors can be what's called giant tumors. Usually the cutoff is about 4 centimeters. So what I'm showing you here is this is the above two pictures. This is a sagittal post-contrast T1 image, and this is a coronal post-contrast T1 image showing a very large pituitary adenoma. Now, these giant pituitary adenomas, the most common type is non-secretory, so they're not producing any hormone. And in that case, the treatment would be to go through an endonasal endoscopic transsphenoidal approach, go through the nostrils and remove what one can. And then I would follow it up with some focused radiation treatment. In this case, it would need to be fractionated over several weeks. And we would also give hormones if the hormones were low, if need be, hormone replacement. Now, the good news is that the second most common giant pituitary tumor is something called a giant prolactinoma. You would be able to make the diagnosis with the routine endocrine blood test that we order. So if the prolactin level is very high, anything over 300 would be diagnostic of a prolactinoma, and often in these giant prolactinomas, the prolactin level will be in the thousands. So with that blood test, we would know that that's what this tumor is, and knowing that, the treatment is with medicines, is with dopamine agonists, usually the medicine cabergoline or Dostinex. And we give this medicine pill twice a week. And usually what it causes dramatic shrinkage of the tumor, improvement of vision and symptoms. And these patients almost never need to be operated on. So this is showing subsequent images on the medicine. This is the subsequent sagittal and coronal images showing the tumor is almost completely gone. So even though this is a very enormous benign brain tumor, this can be treated almost completely or almost always with the medicines. And this is important to realize that prolactinomas can be managed and usually are managed with just medicines alone. Thank you for your attention.